Welcome back to NurseEdScholar. Today, I'm going to change from some nursing tips that I've been doing for the last two videos and kind of go back into nursing concepts. So, I'm going to talk about oxygenation. So, this is going to be a quick overview of oxygenation. Oxygenation, let's just say made easy. Uh, and then the videos following, I'm going to break it down: asthma, pneumonia, you know, heart failure, things like that, that will affect a person's oxygenation, right? So I'm going to tell you the basics of everything that you should know as a nursing student, and then that'll carry on to your regular practice. So, well, let's get to it. So, of course, I have notes up. So, today we're going to talk about just, a fundamental concept. You have to know about oxygenation if you're going to take care of your patient. That's just a given. We practice it daily. And so you're wondering, okay, so what is it? You're a new nurse, you're just starting nursing school. What is it? How does it work? And, why does it matter to you? What role do you have as a nursing student? So we're going to break that down. That's what this video is all about. So, what is oxygenation? So, oxygenation is the process of delivering oxygen from the atmosphere into the cells of the body. It starts when we inhale oxygen into the lungs, and then that oxygen passes through the bloodstream and then attaches itself to the hemoglobin, okay, in the red blood cells. So, in the red blood cells, you have hematocrit and hemoglobin, so the oxygen attaches onto that hemoglobin. And then that carries the oxygen through all the tissues and organs to help them function. One thing you have to understand: without oxygen, and I think you already know this, the cells can't produce energy. No oxygen, no energy. And if that goes on too long, tissues will begin to die. Okay, so that's why it's just so important. Without oxygen, tissues will die. Tissues will die, your patient will die. Simple as that. So let's move along. So what is the oxygen pathway? So you go, we talked about the air into the lungs. It will go into the alveoli, to the capillaries, to the bloodstream, and to the body cells. So let's simplify it a little bit. Ventilation moves air in and out the lungs. Like I said, when we inhale for inspiration and we're bringing it in to our lungs, expiration or exhaling, you're blowing out air, and typically that air is CO2, carbon dioxide. If you've watched the acid-base video, I talk about, too much CO2 will make your patient acidic. So, that when you talk about respiratory acidosis, that's what's happening. The patient cannot blow off or exhale, that CO2. And so then your patient becomes acidotic, and that's the whole problem. Go watch the acid-base video and you'll know what I'm talking about. Okay, and then like I said, through inhalation, the oxygen comes in and it's transported, like I said, to the alveoli, the capillaries, the bloodstream, and to the cells of our body. Then diffusion. So that's part of it. Diffusion means that the oxygen passes through the alveolar capillary membrane to the blood. So we talked about ventilation, you bring it in, and then diffusion is where that oxygen, like I said, goes into the alveoli, then to the capillaries, and then to the bloodstream. Okay? And then perfusion is where that oxygen-rich blood, been inhaling in that oxygen, hooks onto the hemoglobin, goes throughout throughout the body in the blood, and then perfusion is where that oxygenated blood is pumped throughout the body. Okay, so that's basically it in a nutshell. It goes in with inhalation, it goes through the alveoli, the capillaries, the bloodstream, and then the body pumps that oxygenated blood throughout the body, throughout the tissues, to keep them functioning so the body can create energy and those organs can stay healthy. So what's the big thing with this? If any of that pathway is disrupted, oxygenation suffers. That could be by a blocked airway, damage to the lung tissue, or poor blood flow, poor perfusion. Okay, so now we know how our body gets the oxygen and what happens to it when we get it. So how do we measure it? How do we know that our patient's oxygenation is great? Well, we can assess it with two main tools: your pulse ox, it goes on the finger. It measures how much oxygen is bound, so connected to the hemoglobin, and normal is 95 to 100. Okay. Another thing is an arterial blood gas. I have a video about that. You can check it out. The ABG gives you a more detailed picture, including PaO2, which is the oxygen in the blood, PaCO2, which is carbon dioxide, and then the pH. I talked about briefly just a few seconds ago about how if we have too much carbon dioxide, our body can become acidotic, and we'll know that by looking at the pH. So when you're concerned, so let's just say your patient is coming into the hospital with something like asthma or pneumonia, we have to look for clinical signs. So shortness of breath, patient having difficulty breathing, restlessness. When a person is not getting enough oxygen, they may be restless, cyanotic, that bluish tinge, typically you can see it on the lips, um, and a low oxygen saturation. So you'll know that by your pulse ox. And so, what affects it? Just kind of talked about it. There are a lot of things that can affect the patient's oxygenation. So, you can have lung conditions, like I just mentioned, pneumonia, asthma, COPD, or chronic obstructive pulmonary disease. Um, and we're going to go over those diagnoses in future videos. Circulatory problems, heart failure, a low hemoglobin. Environmental factors can affect oxygenation, like high altitudes or smoke inhalation. And then neuromuscular issues, um, things that or conditions that can weaken the diaphragm or the breathing muscle that will allow you to inhale that oxygen into the blood. Those things will affect oxygenation. Okay. So what do we do? What kind of nursing interventions do nurses do that will help improve oxygenation? So there, as a nurse, you play a big role in this, and you will hear this first one all the time. Elevate the head of the bed. Now, unless it's contraindicated, but that would be your first thing. Patient is having shortness of breath. You notice the oxygen saturation is low. Unless it's contraindicated, you will elevate that head of the bed. So you'll position the patient in an upright position, high fowlers, and you'll learn about that. So kind of like, the patient can be flat, and that won't be really good for oxygenation issues, because think about it. If the patient's body weight is pressing against the mattress of the bed, they're going to have a more difficult time taking in deep breaths. So you're going to raise that patient's bed up. Could be a low Fowler's, mid, or high. But what that does is that it reduces the weight of the patient onto the mattress and allows them to be able to inhale more deeply. Okay. Second, you'll be applying oxygen via a nasal cannula or a mask. One thing you really need to look at, depending on your institution. Typically, if a patient's oxygenation starts to drop a little bit, we can apply 2 liters of oxygen without an order. But that may differ based on the hospital or where you live. So always check your doctor's orders. Encourage deep breathing. Deep breathing and coughing. That's a big one, especially after surgery. You're coughing to help expand those airways so it can get as much oxygen as you need. So you'll always hear, especially if you have a post-op patient, have the patient splint with a pillow. So usually if they have an abdominal surgery, you'll tell them to splint, hold the pillow next to the incision, and cough and deep breathe. The splinting is going to help where you don't have extravasation, but that's something that we can talk about later. Or dehiscence, that can happen on your patients. So that's something you'll learn when we talk about periop. But encouraging coughing and deep breathing. Monitor respiratory rate, rhythm, and effort. If you find that your patient is breathing real shallow and slow, you should think, okay, patient in the hospital, is this after surgery? Has the patient had too many narcotics? Okay, if a person is breathing rapidly, then you're wondering, okay, after surgery, is the patient in pain? Like after a car accident, sometimes a person may fracture a rib, so they're breathing really fast because they can't take in that deep breath. So that'll show you different signs if something's wrong with your patient. And then make sure that they stay hydrated unless it's contraindicated, like in those with congestive heart failure. We want to make sure that they're hydrated because that water will help thin the secretion. So if they have a lot of buildup of mucus, getting them to drink, they can cough up and cough get rid of that mucus. And so, these are little things that you need to know, like especially if your patient's condition escalates, uh, by the oxygen level dropping suddenly, the symptoms become worse, and definitely you got to notify the provider. One thing when something is going on with your patient, you need to identify your patient and you need to take an assessment. You need to assess them quickly, take their vital signs quickly, because when you notify the provider, they're going to want to know their current condition. And vital signs and assessment is something that they're going to want to hear. And if your institution does permit you to apply oxygen, at least at 2 liters, you can tell them the intervention that you did and if there was any change in the patient's condition. All right. Um, Last thing is oxygen delivery devices. You'll see, we're talking about oxygenation. We're talking about, you may have to apply oxygen. So there are a couple of different ways you can apply oxygen on your patient. So the one that you will see most frequently is a nasal cannula. For the nasal cannula, you'll be administering between 1 to 6 liters per minute, and that's for mild hypoxia. Okay, mild low oxygen. Okay. A simple face mask, you can deliver 5 to 10 liters a minute. A non-rebreather mask, you can administer up to 15 liters a minute, and that's for severe hypoxia. That will definitely be in order for that. And then respiratory, with a patient in that kind of condition, they will be actively involved in that patient care as well. And then a Venturi mask. It delivers a precise oxygen concentration. Okay, and respiratory will be involved with that as well. And then, but it also depends on what hospital. If you come from a small hospital, I always tell all of my students, nurses have to really know everything from environmental services to complex care. Let's just say it like that. So always be, like I said, always check for oxygen orders, monitor, especially if they have a mask on, but even with a nasal cannula, you want to check for any skin breakdown, especially if the patient's like in the ICU um, for a long period of time and they're unable to move that cannula. Sometimes when things just sit on your skin for long periods of time, or if they have a mask on and it's pretty tight because they're trying to deliver as much oxygen as they possibly can, for long periods of time, that can kind of erode the tissue. So you always have to do frequent checks for any kind of skin breakdown. And then you want to make sure that the patient is safe. And safety, like oxygen is flammable. So, we always say if, a person's on oxygen, of course, they're not supposed to smoke. No one should really be smoking in the hospital, but, you just want to make sure that there aren't any potential. Because sometimes in some hospitals, patients get to leave off the floor and go outside for various reasons just to, get a breath of fresh air. But if they have oxygen, make sure that they are not around anyone who's smoking, please. And so I'm going to end with that. So that's the kind of quick guide to your concept of oxygenation, from physiology to, what we would do at the bedside. So if you found this helpful, I did get a little tongue-tied, um, but give it a like, subscribe, share with your fellow classmates, and I guess that's it. So this is NurseEdScholar, here to help you breathe easier through nursing school and beyond. Happy learning, happy study.